For most people suffering from hypochondria, a typical day often begins with "what if?" followed by an assumption of them having a severe medical illness. It feels like every illness or disease ever known is out to get you. You could be stressing over anything: your allergies, headaches, heartbeat, muscle pain, breathing pattern, nausea, your sister who died of stroke, carcinogenic ingredients in your food, and an endless list of other medical symptoms. It doesn't help that hypochondriacs are extremely aware of their body, making it easy to detect and label every strange or uncomfortable feeling in their body as symptoms of severe medical conditions. It's hard shaking off the intrusive thoughts that would have you convinced that you have an illness and are at risk of dying. In this video, we're going to talk about symptoms, causes, and treatments of hypochondria, and the intersection between maintaining a healthy lifestyle versus excessively obsessing over imaginary symptoms. Hypochondria, which is now known as illness anxiety disorder, is a psychological condition deeply rooted in irrational fear. It is an excessive worry that you have a serious medical condition. Hypochondriacs are usually consumed by the thought of having an undiagnosed medical illness. For instance, frequent urination will have a hypochondriac convinced that they have a chronic kidney or liver disease. Picture this. You're going about your normal day when you feel a slight discomfort in between your eyes. It feels like a headache and lasts about a few seconds. Still, instead of dismissing it as your body reacting to staying up and working almost half the night, your brain is immediately on alert, trying to unpack everything you've read about what you just felt. You remember your Aunt Nat used to complain of this same thing before she was diagnosed with glaucoma? What if your body is trying to tell you that you have glaucoma too, or a brain tumor? And thus, you get sucked into the vicious cycle of hypochondria, dwelling on a feeling to the point of heightened anxiety even after being assured of not having any ailment or disease. This obsession with a symptom can last for weeks or months, and even multiply over time. This brings us to the paradox of hypochondria. The paradox of hypochondria. Ironically, people that have an excessive worry about their health and catastrophize every symptom they feel are 4 times more at risk of dying than people without the disorder. The constant panic about every symptom may lead to chronic stress, depression, high blood pressure, reduced life expectancy, suicide, and sudden death. An observation between 41,000 people suffering from hypochondria and another 41,000 people without this disorder recorded higher death rates in people who worried about their health. Hypochondriacs were also at a higher risk of dying from lung cancer, heart attack, and a couple of other respiratory diseases. Causes of hypochondria. Any event or condition can trigger a person's concern for their health. It could be childhood trauma, family history, delayed diagnosis, and, of course, Dr. Google. These are some of the common factors that can lead to a person's struggle with hypochondria. Now, let's look at each factor in detail. Googling. Most people often self-diagnose by Googling their symptoms. Who knew something as innocent as Googling a symptom to understand what you're feeling can cause severe stress and anxiety? Looking up your symptoms is a recipe for disaster. You get sucked into the multiverse of potential diseases, and this can lead to a downward spiral. Your brain loads up every bit of information, and when next you feel a little symptom, you link it to some chronic disease you read online and start to freak out. Family history or trauma. A person's hypochondria may be a traumatic response to a relative's illness or death caused by a delayed diagnosis. It could also have developed from a family history of a certain illness. An individual with a family history of high blood pressure or paralysis may live in a perpetual state of fear and anxiety even after medical assurances. They may become extra sensitive, repeatedly seeking medical advice and obsessing over maintaining a healthy lifestyle to avoid meeting the same fate. Childhood experience. Some people can easily link their health anxiety to certain things that happened to them as a child. For instance, feeling bloated may trigger distressing levels of anxiety for someone who underwent surgery due to bloating and severe abdominal pain as a child. This is their brain's defense mechanism against reliving that nasty experience, kind of like a once bitten, twice shy situation. Signs you may be hypochondriac. Although symptoms range from mild to chronic and change over time, the following are a few signs that show you have hypochondria. Persistent worrying. I mean, it's totally normal to be afraid of the unknown, but not to the point of living in a perpetual state of fear, overthinking everything about your health and imagining the worst possible outcome. For instance, an average person would probably dismiss feeling nauseous after a meal, but for a hypochondriac, dwelling on that feeling comes first. You start to overthink and draw up different scenarios as to what could that be. Was it a stomach flu? A sign of food poisoning? What if it's appendicitis or hemorrhoids? And thus begins the never-ending cycle. You reach for a homemade concoction that works well for nausea, or ask others who had the same meal if they feel the same way. By this time, you are already incredibly stressed and feeling dizzy or sweaty in the palms. Alarmed, you schedule a doctor's appointment because that nagging feeling just won't go away. Low productivity. People who suffer from hypochondria are usually preoccupied by their obsession with what they're feeling. They may become stressed and unable to function normally, resulting in low productivity or frequent changes in their daily routines. Eating disorders. Another sign you may be hypochondriac is that you're constantly changing your diet or outrightly refusing to eat because you think the food you're consuming is harmful to your health. For instance, you stop eating rice and cereal because you're worried that they're carcinogenic. It could also be excessively consuming a certain food because you are convinced that they're great for preventing illnesses attached to a certain symptom. Insistence on multiple medical examinations. Insisting on multiple medical evaluations despite assurances and remaining adamantly unconvinced about your health status is another sign of hypochondria. Some people even go as far as seeking second and third opinions despite reassurances, all in a bid to validate their fears. Comparing symptoms. Hypochondriacs may seek validation or evidence by comparing their symptoms with friends and family. Measuring how bad your health is by consulting and constantly seeking reassurance from others will only worsen your anxiety. Insomnia. Lack of sleep is another symptom of hypochondria. Hypochondriacs usually get overwhelmed by the thought of having an undiagnosed illness. The feeling repeatedly plays in their mind like a loop, making it difficult to fully relax and get some sleep. Discomfort. Repeatedly checking and feeling your body for pains or abnormal bumps that you imagine are there can also be a sign of hypochondria. Treatment. In most cases, the medical test results for hypochondriacs are usually healthy, with no evidence of any illness or health condition. Informing hypochondriacs that what they're suffering from is an excessive worry for their health rather than an actual illness in their body requires lots of thoughtfulness. No one wants their genuine concerns to be invalidated or dismissed as imaginary problems. Hypochondriacs are already sensitive enough, so one has to explain the need for treatment carefully. Hypochondria can be managed using psychotherapy or medication, and sometimes both go hand in hand. Although there are quite a number of approaches used in psychotherapy, cognitive behavioral therapy is mostly adopted and effective for hypochondriacs. CBT, in conjunction with medication, is targeted at reducing the irrational fear of being sick and helping individuals get on with their normal lives. Cognitive behavioral therapy. Cognitive behavioral therapy is a common type of psychotherapy used to manage anxiety disorders, including hypochondria. CBT sessions guide you to be more in control of your mind and train it to change the way you think and act out your feelings. The process helps you break down your anxieties by separating your thoughts, feelings, and actions. The process guides you through identifying your negative thoughts and why your default is instant paranoia. For instance, if you feel pain in your body, instead of overthinking and concluding it's a symptom of a deadly disease, cognitive therapy encourages you to challenge that thought. Why do I think it's a symptom? Am I reacting to this as a response to a nasty childhood experience, or it's a diagnosed symptom? CBT helps you to assess your thoughts and be more in control. Medication. Medications are usually recommended for hypochondriacs after a thorough physical and psychological evaluation. Qualified professionals prescribe medications to manage an individual's excessive worry and improve their quality of life. Medications are highly effective but can have severe side effects when not used according to prescriptions. Do you think hypochondria is a form of obsessive-compulsive disorder, OCD? Let us know in the comments. Thanks for watching. If you enjoyed watching this video, please give us a thumbs up by liking our video. Don't forget to subscribe to Healthy Feed for more updates.